Hello, good evening, and welcome to today's session at the Bangalore International Center. The Gendered Crisis, Livelihoods and Mental Well-being in India during COVID-19. Joining us are panelists Sanchari Roy, who will be presenting her findings on the impact of COVID-19 crisis on gender dimensions of employment and mental health among urban informal sector workers in India. Sanchari will be in conversation with Nalini Gulati. The full bios of today's panelists will be shared via the chat box, which you see at the bottom of your screen. Next to the chat box is the Q&A box. Please post your questions in the Q&A box. With that, over to you, Sanchari.
Thanks very much, Raghu, for giving me this opportunity to share some very sort of new set of findings that have emerged from some very recent research we have conducted with urban informal sector workers in Delhi. The reason why we feel that it is quite important and quite pertinent to know about the COVID-19 impact on this particular group of people, as I will elaborate in my presentation, is that we know relatively less about them. In the first phase of the pandemic, we saw a lot of information and a lot of images, visuals about how the pandemic had affected the migrant workers, but about the urban poor who remained in the urban areas, we knew less about how they were coping with the crisis. So in that context, our research tries to shed some light on that. And is sort of, among the first to also talk about the mental health implications of the COVID-19 crisis on this group of vulnerable people. So I will share my screen and sort of, talk a little bit about what we find specifically. You can see my screen, yes?
Yes, we can.
Okay, thanks. Thanks, Leka. Okay, so as we all know by now, India has been one of the worst hit countries in the COVID-19 pandemic, and currently we are sort of logging the highest number of cases per day for about a week or so. So we are really facing a ferocious and virulent second wave. So this is how, if you look at the data in terms of number of cases, this is how the graph for India looks like currently. So it's really shot well past the peaks that were achieved that were attained in the US a few months ago in terms of the total number of cases, daily cases that are emerging. So really, we are at the epicenter of this, of the second wave of this pandemic at this point in time. And I do want to clarify here that our work actually relates to the earlier part of the pandemic in the first wave. So as all of us know, right at the beginning of the pandemic hitting Indian shores, the Indian government announced a lockdown on 23rd of March 2020 to basically stop the spread of the virus. What happened after that was, due to the lockdown, due to the complete shutdown of all kinds of economic activity, the economic costs, including job and income losses, food shortages, were massive, right? And this was all over the news. We saw it, we knew it. Alongside that, what was also unfolding was a mental health crisis. And our paper sort of tries to speak to both of these issues as far as our study sample is concerned. And while there have been further research and newer studies that have emerged that have focused on the economic costs, somehow in the context of India, we have focused less on the mental health costs, and our study is kind of one of the first to try and shed light on this relatively invisible shadow pandemic that has been unfolding around us. So specifically to outline our timing, So our study focuses, as I was saying, on the early part of the pandemic, where actually the health implications had kind of been controlled to some extent because all economic activity was shut, but the consequent economic implications were tremendous, and that is kind of the crisis that we are studying in this particular paper. Alongside sort of focusing on livelihoods and mental health, as I was saying, the study, the sample that we study is also of particular interest because urban informal sector workers constitute some of the most vulnerable sections of our population. They have very few safety nets, and therefore, they are much more likely to be badly hit, as we have seen, and as our research and other research has shown, to be really badly hit. Alongside that, as the title of today's talk suggests, we also focus on the gender dimension of the crisis, meaning did the COVID-19 pandemic and the COVID-19 crisis that sort of unfolded following the lockdown, did it differentially affect men and women? Did it affect men and women differently? And if so, along which lines? That's kind of what we are going to sort of, try and talk about today as well. So just to preview our findings, the sort of headline result as far as the economic implications of the crisis is concerned is something that will surprise none of you, that there was massive job and earning losses, okay? And this effect was worse for men. There have been other studies that have shown that, women also suffered, but relatively more than men. Sort of in relative terms, in comparative terms, women suffered more, but the absolute losses were more for men. In our study, also we find this differential effect, but we actually don't find significant effects on women's employment. And I'm going to talk about why we find that and how that is different from the other studies. Alongside that, our second headline result is essentially very high levels of reported mental stress, which were primarily driven by financial and health concerns. This was, remember, in the early part of the pandemic, where people had a lot more uncertainty. We didn't know how we're going to manage this pandemic. When is the lockdown going to end, and so on. And I'll talk about the timing of our survey, which is bang in the middle of the peak of the lockdown. We also find that these two are interconnected, that as you would expect, this is not surprising, that employment losses that were, faced due to the pandemic had a significant impact on raising mental stress. Okay, and mostly this was driven by men's employment losses. So when the man in the house lost their job, this increased the stress levels in the house overall, but it seemed to differentially increase the stress level of their wives. Okay, and we're going to talk a little bit about that. And we find opposite effects for women, and we're going to discuss that as well. And finally, we also looked at sort of the role of men and women's social networks, right? So their friend circles, their friend networks, and whether that had any impact in terms of mediating the effect of the crisis on mental health outcomes. And we actually find differential in the sense of opposite effects for men and women. For men, belonging to a larger friend circle seems to reduce their reported mental stress, whereas the opposite seems to hold for men, which for women, which is quite interesting, and we're going to sort of discuss some theoretical underpinnings of why that might be the case. So after previewing the results, let me take a step back and tell you a little bit about the setting within which we conducted this study. So this was a study that was conducted in the industrial clusters of Delhi. We sort of, have data of around 750 households. And the study was concentrated in about 5 out of 11 districts in Delhi. And if you look at the sort of geographical spread of our study cluster, you see these pink areas. I sort of, point out to you the areas in which the study was concerned. So we were mostly concentrated in this part of Delhi. Okay. And in terms of the information or the data that we collected, we were part of actually the history of this current study is a little bit longer that I'll sort of take 1 minute to elaborate on, just to give you some context. So we were actually running a certain slightly different study, focused on women, focused on industrial clusters, but we had started this study in 2019 before the pandemic happened. And we were sort of in the process of going back to the ground to collect new data, which is when the lockdown happened and sort of everything shut down. So we have pre-pandemic data for our study sample for these 750 households from sort of summer of 2019, and then right at the peak of the lockdown of year, we went back and collected more information, but this time over phone. So the baseline data, the pre-pandemic data, was face-to-face. It was just like a regular survey, whereas the post-pandemic data, the data that we collected in April and May of 2020, was a phone survey. Okay, and during the phone survey, we asked the entire survey to the husband. So this is kind of a small and important point of detail. So all the questions were asked to the husband, but we specifically asked all the mental health questions to the husband and the wife. Okay, so we asked after the husband's interview was completed, we asked them to pass on the phone to their wives, and we sort of asked the mental health questions to the wives themselves. So we have an interesting insight into the gendered dimension of the mental health crisis that was unfolding, specifically both from the mouths of the men as well as their wives. And the sort of key set of outcomes that we focus on. So what are the sort of specific aspects that we focus on? Those are employment. So whether or not the person who was being interviewed was working, what were their earnings? So we wanted to have a sense of participation in the workforce, right? And how that was it, as well as earnings. Okay, so how much income were you making? And then we had sort of a bunch of questions, 5 to be specific, that tried to get at the mental health implications. So we asked questions relating to how stressed they were feeling about the financial crisis that they were facing due to COVID-19, how stressed they were feeling about the health situation, whether they were feeling nervous or whether they were suffering from bouts of anxiety, whether they were feeling depressed or low, and whether they were experiencing sleep disorders. As we know, these are all sort of interconnected, and together they present a kind of broad picture about whether or not people are facing negative shocks to their mental well-being. Okay. So we look at each of these questions individually, but we also created like an aggregate index that combined all these questions together, and that's what we call the mental health index, or rather the mental stress index. So the higher is the value of the index, this aggregate measure, the worse is your mental health. Okay. Now, I'll sort of summarize these tables in a few words. What these are showing is the kind of sort of socioeconomic background of the people whom we studied in this sample. So most of these households, the majority of them are single income households. So very few women, very few households are there in our sample where the woman is also working. And a lot of the profile of the workers, the men in these households, is that a lot of them are engaged in daily wage work, right? So in factories or in construction, or they are self-employed in the informal sector. So maybe they run some petty businesses, or they are in retail, and so on. So sort of connecting back to what I was saying right at the beginning as to the importance of studying the impact of the pandemic on these group of people, is that these are among the most vulnerable of people who would be particularly vulnerable to this kind of massive health and economic shock. Okay, so we really want to understand how the pandemic hit these groups of people, and hopefully our study sheds some light on that. The other interesting factor about our study sample is that though most of these households have been living in Delhi for quite a few years, a lot of them have families sort of that live in other parts of the country, right? So, for instance, nearly 2/3 of these households have families living in either Uttar Pradesh or Bihar or Bengal. So, they have strong connections back to these rural areas. So implications for the pandemic on their income and on their employment also will have ripple impact on what is going on in their families back in the villages, right? So having previewed the sample that we study, let me quickly tell you what we find in sort of, in terms of actual figures on employment. Okay, so this is sort of the first headline graph I want to show you, which is essentially telling you the impact of the pandemic on employment of men, right, in our household. So as you can see, 90% of men reported being employed before the pandemic hit. So this is from our 2019 survey, and only 6% report being gainfully employed or working in our post-pandemic. So there is this huge, massive negative shock to people's working status, specifically the men, whereas for women, we don't find much of a change. And part of the reason that sort of explains this slightly different results compared to, let's say, some of the papers that have shown that women's employment also fell is because our initial field visits revealed that a lot of the women, whoever was working, they were working from home, in the sense that they were working on ancillary activities that are related to, let's say, their nearby factories. For instance, I'll give you an example. In many of these industrial clusters, there are many factories. Some of them, let's say, for instance, there are leather factories, okay, maybe manufacturing shoes or other kinds of leather goods. And we often found in our initial field visits, and also that came up through our survey, that many of these women were working from home. So they would have contractors with the with the factory, where a part of the let's say leather goods making production process is done by them at home. So maybe they are responsible for sticking the top part of the shoe. Okay, so there are certain activities that the women who were working were engaging in, which could continue to be done from home, right? So it's possible that this is what prevented these women from having to sort of face a negative impact on their working status, and it's sort of driving the effect of there being no significant change in the women's employment status. And if we look at the sectoral composition of the workers in our sample, and let's focus on the men for now, you see that I mean, everybody was affected, but it seems like the casual workers, the wage workers, the daily wage earners were the ones that bore a slightly bigger brunt of this, right? Salaried workers were also affected, but probably at the margin, they were a little more protected. Whereas for the casual workers, basically, they didn't work. They didn't work at all. And this is also consistent with what we have seen in terms of anecdotal evidence coming out of that particular time period, that essentially there was just no work to be had at a daily basis. Okay. Now we want to focus on earnings. So the income shock that these people sort of faced, and again, we focus on men. And here again, the income shock was massive. So if you look at the sort of the unconditional earnings, monthly earnings. So this is how much would you have made in the last 30 days, right? You see again this massive drop, and in percentage terms, it's about 90%, 85 to 90% drop in the monthly earnings. So it was again a huge, massive shock, not just in terms of work days, but also in terms of remuneration. So this combined together to create, so this is just to give you a sense of the numbers. We all know that this was happening, but to give you a sense of the proportion of how severe the shock was, hopefully these results could give you some sort of a picture here. Now I want to focus on mental health. and sort of, finish off the remainder of the talk focusing on this. And again, as I was previewing in my findings at the earlier part of the presentation, we find very high levels of reported mental stress. Okay, so for instance, if you look at these graphs, the green ones are the men and the blue bars are for women. You see that between 93 to 94% of men and women report having faced severe financial stress and really exhibiting symptoms of that, including anxiousness and nervousness, anxiety, depression, sleep disorders. So essentially, this is kind of giving you a sense of the extent of the mental health implications, which is kind of the invisible part of what is happening here. But alongside these very high levels of reported mental stress, we also see interesting gender differences. Okay, so for instance, the most prominent gender difference that comes up is in terms of nervousness or reported anxiety. And we find that women are significantly more likely to report feeling anxious about their current situation. And as some of our later results will show, this is often tied to the employment losses that their husbands have incurred. Okay. But we also find sort of differences in terms of sleep disorders. So across the board, it seems to be the case that women are reporting that they are experiencing greater mental health issues and a greater shock to their mental well-being relative to men, while both of them are facing pretty high levels overall. So we then try to sort of delve a little deeper into what could be potential explanations of these gender differences. So if we want to connect some of these findings to sort of the broader literature, that is emerging from not just the developing country context like in India, but also from developed country context, right? This seems to be a systematic pattern that is emerging, that women are significantly more likely to report a greater amount of distress, mental distress, as compared to men from the pandemic. But maybe the reasons that are driving some of these differences are very context specific, right? So maybe some of the reasons that are driving these differences in the US or in Europe might be different from the ones that are driving these differences in the context of India. So we try to sort of dig a little deeper into this. And specifically, we sort of look at the interconnection between the employment losses, so the income shock, and the mental health shock. Okay, that's one. And then we also sort of, going back to a lot of rich analysis in the sociological literature, we try and look at the role played by social networks of our participants in mediating this sort of, impact on mental health. So first, looking at the role of employment loss due to COVID, so the pandemic-induced employment losses on sort of these mental health differences, we find that indeed employment loss for men affected mental health of men and women, but it sort of affects men and women in different ways, coming from the fact that men's employment losses affect men and women sort of, in a negative way, but women's employment loss actually goes in the opposite direction. So what do I mean by that? So what I mean is, we find that men losing work due to COVID-19 increased mental stress overall, both for husbands and wives, but slightly more for wives, okay? Whereas if we look at women that continue to remain employed through the pandemic, as you saw, in terms of our descriptive results, there was not a lot of change, significant change in terms of women's employment, at least working status. But we find that women who remained employed during the pandemic, they report higher mental stress, as well as their employed husbands. unemployed husbands, right? So that seems to be a little puzzling, because you would expect that employment losses are going to, create adverse effects for everybody's mental health, no matter whose employment loss is being considered. But that doesn't seem to be the case. It seems that men's employment losses are driving greater stress, but women remaining employed in the face of men losing their jobs seems to be driving stress overall. And one way we try to sort of, interpret these findings is through the lens of internalization of the male breadwinner norm, which is sort of, making the case that it is the man's job to sort of provide for the family, right? And it is not necessarily the woman's job to do that. The woman's role is more in the context of being a homemaker. While the men are employed, maybe this difference is not as stark, but once the men have lost the jobs, when the women are continuing to remain employed, maybe that is creating a lot of friction or a lot of tension within the family, which is creating stress both for the men as well as for the women. So it is sort of internalization of these norms, potential internalization of these norms on both sides, both the husbands as well as their wives, right? This could be one potential explanation as to why we find these differential effects, these different effects arising as far as the relationship between employment loss and mental well-being in our context. And finally, I'll end with talking about the role of social networks. So here we mean networks of friends and family, right? So what we did in this context is we had information from our 2019 pre-pandemic survey about who are the friends of our participants. So we asked each of our participants to name, some of their closest friends, and we have a sense of how many friends they report as being their close friends. And we can therefore have an idea about how large is their network size, okay, or how large or small is their network size. And as I was saying, there's a rich literature in sociology that argues that social networks can either have a stress busting or a stress buffering role, in the sense that, okay, I'm under a lot of stress, and my friends, when I talk to my friends, that acts as a way of releasing the pressure, right? So it sort of buffers or creates a buffer in terms of my stress, or it helps me reduce my stress when I have opportunities to talk to or interact with my friends. So the idea would be that a larger friend circle or a larger social network would act as this kind of stress buffer. Alternatively, there are also theories in sociology that argues that, there could be an opposite effect, a stress-contagion effect, in the sense that if I'm stressed and I'm sharing it with my friends, and if they're also stressed, then we end up just sort of, stressing each other out more. And we try and see if we can disentangle these two sort of, potential explanations of, how social networks may mediate the mental health effects of COVID-19 using our analysis. Okay. So what we find is that women with more friends, so with larger network sizes, on average tend to report higher mental stress. Okay, but the opposite is true for men. So for men, having a larger network size seems to sort of reduce their mental stress, in the sense that if a man has a larger social network size, then they are less likely to report being very stressed. Okay, whereas it's the opposite for women. But then the question is why? That's quite puzzling. Again, we see a sort of a snapshot of very different results as far as men and women are concerned. But the interesting question would be to understand why. Well, one reason could be we found in our pre-pandemic survey, where we collected the data on how many friends do you have, we found that women tend to report having more friends. Okay, so on average, they would report between 5 and 6 versus men who would report between 3 and 4. So could it be the case that, they were missing their friends because, this was the time when the lockdown was at its harshest, you were not allowed to step out of the house. So, you were missing your friends and you were not being able to benefit from the stress busting role that your social network, your friend circle was playing. And therefore you were just too stressed out, right? Or could it be that women's networks operate in slightly different ways than men? Could it be that women's networks tend to generate more stress contagion than men? So to disentangle these two sort of, potential explanations, or at least try to disentangle it, we look at women who own mobile phones, right? So the idea would be that if you own the mobile phone, right, you could still keep in touch with your friends, even if you're not meeting them, you could still keep in touch with them, right? And that could potentially sort of, reduce your stress. And remember, these are households where not all women have phones, but there is a fairly substantial proportion of women who do. So we do have variation. It's not like everybody has phones, in which case we wouldn't be able to look at this. And it's not even the case that nobody has phones. So we have sort of, some women who have phones and some women who don't. So we compare between these two groups. And we find, interestingly, that among women who own mobile phones, so these are the women who would have told us that they own mobile phones in 2019, pre-pandemic, okay? We find that those with more phones are also the ones that report greater stress, right? So this kind of seems to point to the stress contagion role rather than the stress buffering role, right? Which is the case that, everybody is stressed in this particular very uncertain times, in these unprecedented times. And when we are talking to each other, we're actually sort of increasing our individual stress because nobody really knows what is going on and everybody's uncertainty is rubbing off on others, right? So I'll conclude here. And obviously, I look forward to all the questions in the Q&A. But just to conclude and summarize what we find, sort of in this study, we sort of present, we give you actual estimates of how big, how large the negative effects of COVID-19 has been on sort of income outcomes, including employment and earnings. And we find that this to be very high for men. We find relatively insignificant effects for women, and sort of for the reasons that we discussed earlier. And we also find very high levels of reported mental stress. These are all self-reported. And we find that women report greater mental stress relative to men. And we find that there is a sort of feedback loop between employment losses and these mental health adverse implications for mental health, specifically for men's employment losses. So, there is a feedback loop that can have implications for how the pandemic, implications of the pandemic pan out in the medium to long term. And we find that this interesting difference in terms of how friends and family networks can affect men and women's mental health. We find that there seems to be an exacerbating effect on women's stress, whereas there seems to be some sort of a mitigating effect for men's stress. I'll stop there.
Thank you, Sanchari, for taking us through the key findings of your study. This is indeed an unprecedented and dynamic situation. It is crucial to have the sort of rigorous evidence and analysis emerging from the ground, a more nuanced understanding of who was more affected, in what ways, what kind of jobs were more affected than others, what are the underlying mechanisms of what we are seeing in order to inform policy responses and to ultimately, build back better. As you said, somewhat more has been known about the plight of the returning migrants from cities to villages, and that aspect of the humanitarian crisis was quite visible as well as in the media reporting. So your study makes a very important contribution by focusing on the urban poor who stayed back in the cities, and particularly by capturing the mental health aspects and the gendered aspects of the crisis, and we'll talk more about that. So first, I would like to ask you a little bit more about your survey methodology, which was the phone surveys. When the nationwide lockdown was imposed in India on 25th March 2020, all of our in-person interactions were paused abruptly. There was no indication of when things might normalize. In fact, today we are again in the grips of a severe COVID wave, which is reminiscent of that time period from where your study is. And so, field work for research was stopped. You and your research team had the advantage of already being in touch with about 750 low-income families in the industrial areas of Delhi. So phone surveys have really become the go-to methodology in this scenario, right, for collecting evidence. Perhaps they even have certain advantages, but at the same time, there are concerns around their use. So for instance, in your survey, you also have questions around mental health. And as you said, the primary respondent on the phone was the male head of the household. And then for the mental health questions, they were asked to hand the phone over to the wives, but just conscious of the fact the spouses are present when these questions are being asked. Would that have been different had you had the opportunity to go into the field the way you usually would have? So I wanted to just hear your thoughts on this more broadly, phone surveys as a methodology. And in your view, do you think they would continue to be an important part of data collection in development economics once the dust settles and when we're thinking of a post-pandemic world? For your study in particular, what were the challenges that you faced and how you addressed?
Yeah, no, that's a very important question, Nalini, and something that I think everybody is waking up to. I mean, all kinds of data collection methods have their pros and cons, but in this context, nobody really had much of a choice. Many, as you said, we were lucky in the sense that we had the phone numbers of our study participants. Therefore, we were able to quickly transition to a phone survey. Otherwise, phone surveys can be quite complicated. Although I think as people have done more of them, people have also learned on the field about how to minimize some of the challenges. Because, for instance, one challenge I realized, which is quite specific to maybe a developing country context like India, is that people change their phone numbers a lot, right? So, you may or may not be able to get hold of, the person whose number you had. We did face some of those challenges as well in terms of attrition. We tried to sort of, overcome them by sort of, repeat calling and so on. Still, we did have some attrition, which is just something we have to live with. But the main, you raise a key point, which is about, privacy. And the challenge here in our context, excuse me, is that we really had no way of getting around the spouses being present or anybody else actually from the household being present. This is not completely washed away in a face-to-face interview because, we've had many instances where despite repeatedly politely requesting the woman be given privacy, we see often in face-to-face interviews that people are hanging around. But this is just, the degree of this is much higher in a phone survey. And I think the implications of the phone survey will be different depending on the kind of results you're focusing on. So for instance, in our context, we actually feel that maybe even if the husbands were hanging around, the women were probably likely to underreport the stress that we were facing. So for all the results, the effects were actually even larger than we estimate. So it could be a lower estimate or a lower bound. But these don't take away, that is in our context, but this doesn't take away from the genuine concern of privacy, which is why I think once the dust settles, once we go back to normal, I think we will see an increase in the use of phone surveys, particularly for certain kinds of questions, certain kinds of surveys, certain kinds of questionnaires and survey instruments. So in instances where, for instance, we need to make a quick, rapid response kind of, survey data collection, we can do this in the context of maybe just asking basic demographic, non-sensitive questions, we can do it, right? But for deeper, comprehensive data collection, open-ended, semi-structured interviews that many anthropological, sociological studies, or ethnographic studies depend on, I don't think we will be able to completely substitute out of face-to-face surveys. So I see a hybrid model developing, but I feel that the pandemic may have alerted us researchers to some of the benefits of phone surveys, which we might have been blindsided to earlier because, nobody really needed to do it. And I would say the biggest benefit I felt of very quickly going from a face-to-face survey to a phone survey was how streamlined we made the question. We had to be brutal in terms of how many questions we could ask, because we couldn't realistically hold anybody's attention beyond 15-20 minutes. So it was a really we thought a lot. We really designed and streamlined the question in a much more efficient and effective way, which I feel will be a learning for all of us going forward, and we can bring that to a post-pandemic situation as well.
Sure. So it's been kind of a forced experiment, and some benefits have emerged, and probably going forward, these could be a supplement to the traditional surveys and maybe helping expand the sample size of studies and things like that. And specifically regarding the mental health point, as you said, that just means that we think of these as sort of lower bounds of what you're seeing, the effect that you're seeing, and the differences across gender.
That would be my prior.
Yeah. So slowly, as you said, I mean, other evidence on the socioeconomic impact of COVID-19 is coming out. One such study that has been widely reported in the media, which perhaps many in the audience have seen, is by Professor Ashwini Deshpande of Ashoka University. She has analyzed national level high frequency data from the CMIE on the job situation over the past year. And she finds that in April 2020, so the same time period as your study, there was a large contraction in employment for both women and men, with more men losing jobs in absolute terms. I suppose this is expected, and you said that, as more men than women are in the labor force in the first place. But I think in her study, even in percentage terms, there is a difference. So the number of men who report themselves as employed drops by 29% between March and April 2020, while for women, this figure is much higher at 39%. So on the other hand, in your study, as we saw, it's basically the men who took the hit and women's employment was not affected. So in your view, what explains this difference? Is it because the two studies are looking at different demographics or the kind of work that the women were engaged in? And more generally, what is your reading of the emerging literature on the gendered impact of the crisis on jobs in India? I think since then, the official data, the periodic labor force survey has come out, I think, quite recently for that period, which is April to June 2020, quite a bit of lag. Or, there have been other studies, and especially in the urban context, some researchers have taken data from popular job portals and analyzed. So just your overview of the emerging literature and how the study is situated in that context.
Yeah, no, absolutely. So I think to answer the first part of your question, why what we seem to be finding is bucking the trend. We find that there's not much of an increase, is primarily driven, in my opinion, by the kind of work that the women in our sample are doing. So if you remember, I was sort of mentioning that from our base data, but also this that we did and the initial conversation we were having, we saw a lot of these women who are engaged in work, right, are doing work from home. So they are trying to fit their work around the schedule of home care and domestic care and child care, right? And they are more flexible. They're using that kind of flexibility to be able to continue to do gainful employment, but not have to sort of leave the comfort of their home, right? And in the sort of physical spaces that we studied, we also found there was quite I would say a significant amount of pushback against women leaving the home and going out to work, the kind of work that they might be doing. There was not a lot of support for women going and working in factory floors and so on. So all of those combined to sort of result in the kind of work that these women were doing, which was to some extent probably at the margin a little bit more immune to the lockdown, right? So for instance, in Ashwini's paper, I think she cites this study using LinkedIn data, where they find that there was, I think, about a 6 to 7 percentage point increase in the labor force participation of women engaged in white collar work. And this was mostly around the normalization of work from home and the increased flexibility that offered. Now, we are looking at a very different sort of group of people, but at some level, there is this commonality of flexibility of the kind of work, right? As we know, many domestic workers who are predominantly women lost their jobs, right? But those are not the people whom we are picking up in our study. So this is looking at a slightly more, I mean, definitely a minority, right, but we are still looking at a group of people who have some sort of, I would say, who were able to buck the trend in terms of the implications of COVID by virtue of the kind of work they were engaged in, right? But I must say that we are also digging a little bit deeper into this using our survey data as well to really parse out what kind of work. So what I mentioned to you was mostly anecdotal field visit information, but we collected this kind of granular data in the baseline survey. So we really want to look at specifically what kind of works were relatively more protected and what kind of works were vulnerable. Okay. Regarding your second question, yes, I think the overall sort of picture that is emerging as far as COVID-19 impact on women's employment and women's work, not just in India, but across the spectrum in the US, in Europe, in UK, it is the case that there have been massive shocks. So what we are finding, although I'm giving you the potential explanations of why we find we buck the trend, this is definitely not a common occurrence. The more common picture is of massive losses in terms of women's employment labor force participation, to the extent that I think in the US, what is coming out in terms of a picture is that women suffered double the losses in terms of women withdrawing from workforce relative to men. And in the context of India as well, for instance, as Ashwini's work shows, or as many of the other more recent work shows, there is a systematic impact on women's work. And the bigger worry is when the recovery, well, now we are again in a tricky situation, but last year when the recovery was happening, it would be whose recovery would again shoot back up. And there would be a slower recovery of women. So already it took us many years to get to a stage where we were in terms of female labor force participation. But the sort of setbacks probably take many more years for women to overcome and close the gap with men. And I think this is intimately connected to, again, the kind of work women are doing at home, right? And sort of, if you think about the advanced economies, and if you think about formal sector work, a lot of work shifted home, yes, but also schools closed. Childcare was not available, right? So if you look at time use, women were sort of, juggling a lot of work. And, again, if you look at anecdotal evidence or you look at research evidence, what seems to be emerging is that women are leaving the labor force in larger numbers, not sort of, not being able to manage this as effectively as they would have liked, and therefore are being made to, or being forced rather, to make a certain choice, and then coming back, right, and reaping the benefits of their work experience or their tenure will become that much harder. And this might have implications for promotion, for retention, for leadership. So it's just sort of, a snowballing effect that is being seen in the context of women, especially because I think of the challenges of slow recovery.
Sure. So sort of these two sets of factors working in different directions, and we really have to see which way it goes. As you said, it's believed that when work is more flexible or it can be done remotely, that benefits women and they're able to participate more. But at the same time, the nature of the pandemic has been such that the home space has changed. What is the domestic responsibilities have changed and increased. How do you think this connects with, pre-COVID, the broader literature? What does economics research say about, what happens to women's labor force participation in times of crisis, like not just COVID, but in general? I think your study is sort of more in line with,
Yeah, no, I think it's interesting. So while, I mean, this is why I think that there's a bunch of papers actually that focus on the negative implications of COVID-19 on women's employment and making the case that this time it's different, this time is different, that women are also significantly affected, and probably more so in certain contexts. Whereas there has been some literature in the past, especially from Latin American countries, around debt crisis, where there has been studies that have shown that women's employment is actually countercyclical, right? So in the sense that when the economy tanks, right, when for some reason at the margin, women's employment seems to sort of rise, partly because, again, it could depend a little bit on the nature of work, it could depend on timing, it could depend on government initiatives, that women seem to be substituting a little bit for men's work, right? So the literature is kind of, mixed in that context, and it really depends on the kind of crisis that we are talking about. And this is what has been highlighted very strongly in terms of who did the pandemic hit the most. So if you think about the sectors where a lot of the losses were incurred by women in terms of employment, those were care work, those were, let's say, frontline workers, right, in health, in hospitality, in many types of retail, which was very specific to this particular pandemic. It's just the nature of it, how it unfolded and completely exploded, right? So I guess the literature is mixed, and depending on what kind of crisis we are looking at, we find differential effects on women's employment. But there have been evidences, as I was researchers that has thrown up evidence that women's work could go the other way and buck the trend, and to some extent actually cushion some of the effect of the crisis for the household.
Right. So in your case, it's reported by the husband. So you see that it doesn't change. Do you think it's possible that it's actually masking a little bit of an increase? Because in a crisis situation, when there is financial stress on the household, this kind of self-employment work of women that they're doing within their homes, or work that factories close to their houses is given to them, it's become more important. That maybe in the pre-crisis, pre-COVID situation, the husband would not have attached too much importance or considered the wife to be employed or contributing to the household in a real way, and it is still, it's now also reported by the husband. So, or are you taking this to be your senses that these are actuals that are being reported, both pre-crisis and on the phones?
I think so. It would be a little difficult to speculate here, because it could well be the case that there is some kind of, underreporting. Sure. Because in the baseline, we do know that we do find that there is possible underreporting by the husbands in terms of their wives' employment. But it was not a lot. So if it is, it could be the case that underreporting has gone up. That would be the more interesting, instance, that really actually women are working, but where men are significantly more likely to underreport post-COVID. Now, the question, the point I want to make here is that theoretically, in principle, it could go either ways. It could be that, now, my home, I'm not working. I'd rather at least say that my wife is working. So that would mean that I'm over-reporting. Right. Or it could be the case that if there is internalization of male gender, male sort of, breadwinner norms, then I don't want to say. So then it could be underreporting, greater underreporting. So it's not entirely clear, and this is very difficult to tease out in the data, but it is not entirely clear which way it has swung, right? My sense would be that, given that we find those interesting results where we find that women's continued employment seems to increase stress of the husband, here I'm speculating because I really don't have the data to back it up. It could potentially be the other way, right? So we are probably picking up pretty much the truth.
Okay, so I think segueing to sort of the findings on mental health, and it's such an important contribution given the dearth of evidence on this aspect. The pandemic is a period of high stress for all of us around health, financial uncertainty, social isolation, but even more so for the vulnerable populations. As you said, they are in informal jobs and they have inadequate or no social security nets. So in your study, you have specifically discussed linkages with social networks, and this is something you had collected information on prior to the pandemic as well. And so these are really sort of fascinating findings. So do you think these gendered psychological impacts can have longer term effects on productivity and well-being? And I mean, as you said, there's probably not a lot of other work from India. So, I mean, overview of the related research, if not from India, then from other countries, because I think even at the national level, the latest data I've seen is probably from 2017 or 18 in India. And that too does show that mental health outcomes are worse for women. So yeah, just if you would like to talk to sort of what you think the long-term effects can be, and what other studies are showing this.
Yeah. This is a tough one because the long-term effects overall, not even looking at the gendered implications, but the long-term effects of COVID on mental health is only emerging. We are sort of, seeing discussions, hearing discussions around how some of the mental health challenges that COVID has given rise to might actually outlast the pandemic. We are hearing conversations around this. I think there was a study in the British Medical Journal about this, but it's unfolding the picture. Now, whether these immediate impacts that we are estimating in our study in terms of the pandemic impact or the crisis impact on mental health will sustain itself in the future, it's difficult to tell. There are arguments on both sides of the coin, because one, you could expect that, once there is this kind of a massive shock to your mental health, it will take a long time to recover. So then that speaks to the sort of, outlasting effect. Alternatively, we also saw that there was this feedback loop with employment. So as economic conditions recover, we might expect some of those effects to sort of, melt away a little bit in the margin. So it could be a mixed picture. However, what I feel actually might be more interesting for us to study alongside the direct effect is also how the other effects of the crisis is affecting mental health and what that can do to productivity and well-being in the future. So because of this interconnectivity, because of the fact that, okay, I'm out of a job, I'm really depressed, I'm really, and there's so much, terrible news floating around, and I really don't see any light at the end of the tunnel, that makes me much more prone and much more vulnerable to anxiety and nervousness and maybe sleep disorders and so on. That can affect my productivity in an eventual job, or even the likelihood of getting and retaining an eventual job, right? The other point I want to point out here, we haven't, we don't look at this in our paper, but there is a very interesting paper, and I think the UN has also highlighted the other shadow pandemic, which is domestic violence, and how the lockdown has had massive effects. And we have a very interesting paper that has just come out, which has estimated the effect of this kind of lockdown on domestic violence and the increase in the incidents, the reported incidents. And these will also have implications for mental health of women, right? In their domestic spaces, in their domestic spheres, and how these will find expression, and what the ramifications of these will be in terms of sort of recovery. Again, going back to the slower recovery for women point, right? I find these to be much harder, but much more pertinent questions to which I don't think we have immediately a straight answer. But hopefully, as we gather more data, as we get a better understanding of how things are unfolding, we might be able to speak to some of these issues.
So in your study for this time period when the national lockdown had been imposed, it seems that for the urban poor, the mental stress is related more with financial woes than health. Maybe that was the case in that initial phase of the lockdown, and was sort of like a disease of the rich, and more related to foreign travel and things like that. So their main concern was, and because this is a group that has informal jobs and they don't have large savings or social security, so for them the concern was financial. And this shock to earnings may increase the economic and psychological burden of the women in the household in the longer term as well. So it is crucial that the policy response to the crisis incorporates this gender dimension. So in this context, I wanted to talk to you a little bit about John Rez's proposal of having an urban employment program. He calls it DUET, which is the Decentralized Urban Employment and Training. So I won't go into the details of the proposal. That's also a whole discussion and debate in itself. But it's in short, it's something like what NREGA does in rural areas, that it it's this fallback job option that involves hard manual labor and it's at minimum wage. And at the same time, it'll have the advantage of building and maintaining our urban infrastructure. So in a recent variant of DUET, John Rez has also suggested giving absolute priority to women. So even going beyond the sort of 1/3 reservation that NREGA has, and to involve women even in the running of this program. So do you think, in the context of like what you've seen with your group, or this urban poor demographic in industrial clusters in Delhi, do you think this is something that can benefit them, or would you prefer other kinds of social protection, like some kind of basic income guarantee?
No, I mean, it's a fascinating proposal, the DUET, and I think it's, I think the sort of intellectual, I would say the intellectual prowess is how it tackles both urban, sort of the urban job crisis as well as urban decay, right? Regarding giving absolute priority to women, I mean, I feel it could end up being a double-edged sword unless we really think through the details and all the devil in the details about it. Because again, emerging from our study, what we found is probably because of the lack of normalization of, you know, women's work in the public space, in the outside space, right? Especially in the context that we are looking at, you know, this is Delhi and so on. It's a little bit of a worry in the sense that how are we going to identify what kind of work women would do, right? And are we going to put women in silos in terms of types of work that we are going to do? Because if it is all kinds of work, there might be resistance to take up. It might sort of, you know, undermine the bigger picture of what the proposal tries to achieve, right? And also my concern is about how we can connect the gender aspect of this to the efficacy aspect of this, right? So my question would be, are we trying to achieve too much within one policy proposal? The flip side of that might be that, you know, actually having more female employment and more female involvement spaces in urban public spaces. But how we sort of, you know, think about the details of it and how we are going to create situations where it is looked upon as being desirable. Because we have this whole concept of, oh, this is good work, this is not good work, this is dirty, this is not dirty. How are we going to address all of that? And the idea of, you know, men and women sharing the same space, ideally that's where we want to go. But is a more targeted and a more segregated approach the right approach to get there? Or do we need to think a little bit more carefully? So I mean, I'll put it this way, I have not yet made up my mind about how we can sort of, you know, co-opt DUET, but I wonder whether there could be sort of further considerations to be had. Regarding what you were saying about basic income, I think that's probably a stronger sort of, you know, route to go down, at least as far as now, especially given the immediacy of the concerns, right? And if you think about some of the political party manifestos, so Trinamool Congress just won in Bengal, and part of their manifesto was that they will give 500 rupees into the account of every woman. I think there was something along these lines in Tamil Nadu as well, in Kerala as well. So I feel that perhaps a basic income, right? If not universal, maybe something along the lines of sort of making it a little bit more specific to women might have a greater, or let's say might have more legs currently in the current scenario, and then build up to something that sort of works in a much more systematic way. The other point I wanted to make is regarding, at least again in our relatively sort of niche context, we found that information seems to be a big constraint for women as far as jobs are concerned, right? And again, the kind of networks that a lot of our women in our study have, they're pretty home based, right? So based around the home, around the neighborhood, not a lot of diversification of information nodes. So probably trying to bridge the information gap might also play a role at the margin on a much more smaller scale, right? Because it's both a demand side story and a supply side story. And I feel that, a setup that tries to address both might have slightly more success, but I guess the details will need to be thought out much more carefully.
Right. I have some follow-up questions, but I'm going to go into, I've had my chance and I'm going to go into audience Q&A. So the first question is from Amrita Rudra. Since the time span that your study examined is until around May 2020, how much do your results and findings engage with and are influenced by the migrant worker crisis, which had a peak till around September 2020?
Yeah, no. So basically, we are not able to say much about the migrant crisis that was actually unfolding around the time of our study and continued beyond, except to say that, like I was saying, a lot of our the households that we studied, they have roots back in rural Uttar Pradesh, rural Bihar and Bengal. So there would be sort of ripple effects, but our study was not sort of designed in a way where we could actually look at some of these implications to understand, from a different lens, of course, because these would still not speak to the visuals of the migrant crisis that we saw. Millions of people trudging back on the highways of India, but it would give us at least some kind of sense of, let's say, for instance, how long-term migrants would be sort of, or the economic well-being of long-term migrants, how that may have ripple effects back in the villages. But our study was not actually designed to ask that question.
Sure. Comment from Srinivasa Murthy that the design of the study has the strength of having data from pre-pandemic period. We agree. And there's also a question, the key measure of mental distress is not fully understandable. Is this a standard tool? In disaster mental health research, there are a number of standardized tools which are more broad-based.
So that's a good question about the methodology. So basically, what we use is kind of so I told you about the 5 different questions we asked, and we had to keep it short because we had to keep the survey because it was a phone survey, so we couldn't go into a lot of detail. So we picked some of the key sort of dimensions of mental stress that the psychological literature has pointed on, and also the economics literature has been sort of getting into, including sort of depression, sleep disorders that I mentioned. And essentially the response to each of these questions would be whether it was on a Likert scale, right? So from 1 to 5. So whether they agreed that yes, they were feeling low, or yes, that they were facing sleep disorders, to no, they were not. And there was range of answers in between. So what we did is we looked at responses which would be either yes, we were facing these symptoms, or so agree that we face with these symptoms, or strongly agree. So if they either reported as agree or strongly agree, then we classified this as them experiencing a sleep disorder, or experiencing depression, or experiencing anxiety, and not if they responded in the other using the other responses. So what you saw in terms of the bar graph that I showed you would be sort of picking up that kind of a variable, where it's essentially a 0-1 variable, right? So if it is a yes, agree or strongly agree, then that's a 1, or it's a 0. And then we had this mental stress index that we combined, which was essentially a standardized measure. Okay, so this is kind of unit-free measure in which we combined all the different variations that we have seen from the 5 different questions into one specific methodology. This is quite common in both the psychological literature and also in the emerging economics literature to get a sense of aggregate stress, right? Not just looking at the disaggregated questions, but also looking at it in an aggregate way. So that's how we did it.
So question from Manjusha Warrior and Srinivasa Murthy has a similar question, that basically, is this like a mixed methodology study? Do you also have some qualitative analysis of the experiences of the men and women in the study? Or is it all driven by this phone survey, or
No,
is there like a qualitative
primarily, yeah. No, this particular study, the phone survey that we did was essentially only a phone survey. We didn't have any space or any way of sort of, deeper into sort of, the narrative. But what we did have is information from the pre-pandemic study, where we conducted sort of extensive focus group discussions, basically to understand the context within which we were locating the study. So the post-pandemic results that you see, these are only from the survey, so these are purely quantitative. But we have rich sort of, qualitative information, data from focus group discussions, from sort of, open-ended interviews, semi-structured interviews that we conducted. But these were all pre-pandemic that would inform how we interpret some of these findings that we had post-pandemic.
So the next question is about the mental stress results by Mohan Isaac. Like, how can one explain the increased mental stress in women with higher social networks? So probably some further clarification or explanation of that result.
Sure. So like what I was mentioning in the presentation, so we think there could be, obviously there could be many reasons. We kind of drill down on a couple, and we sort of looked at the differential role that employment losses might have played. So the feedback between employment loss and mental health, and how this feedback loop might have been different from men and women, right? And we find that for women, the husband's loss of employment seems to increase their mental stress more than the husband themselves. And this we are trying to then connect to potentially some sort of a stress contagion story, whereby we find that women who reported having larger friend networks in the with the pandemic are also the ones who are reporting this higher level of stress. So it could sort of point to a direction of an overall sense of uncertainty, a situation that is affecting everybody, right? So, the people with whom I'm trying to talk and maybe wanting to reduce and sort of, relieve some of my stress actually is having the opposite effect, because everybody is equally stressed and we're just ending up sort of having being caught in this stress contagion. So this could be one potential sort of explanation, and the effect seems to be going the other way for men. So for men, it could be the case that, and we are speculating here because we don't have data on this, but one sort of in principle, one theoretical way of understanding this could be that, well, men are thinking, look, we're all in the same boat. I lost my job, so has my friend, so has my friend's friend. So, okay, maybe, we'll just weather it all together. And maybe the way they are responding to this kind of crisis, and remember, this was the early part, right? So they didn't know what is coming, and maybe it could have been the case that people at that point in time thought that, okay, this is a temporary blip, it will go. Like, who thought that we would be in middle of 2021 and still facing another wave? So it could be that, differentially, the men and the women are responding to that kind of uncertainty and crisis situation within our study. So that could be one explanation.
So related, small follow-up question from Lakshmani Krishnamurthy is that, does having an unemployed, frustrated husband also being homebound add to the stress of the wives? That probably again getting picked up in the right. Also
in
related,
fact,
since women run. Sure. Go ahead.
No, no, I was just saying that I think that's entirely possible. Again, I don't want to remember these are all sort of, we're trying to sort of come up with various ways in which we can explain this. We don't have sort of actual data to measure this, but it's entirely possible. In talking what is going on. It's entirely possible that, stress levels at home were just, very high, and this was just leading into the interaction.
So I mean, what the effects are picking up is speculation, and I think your interpretation is also driven by the related literature and such.
Yes.
So another question by Lakshmi Krishnamurthy: since women run the household, managing food, needs of children, worry about their health, etc., their interaction with each other would relate to these topics, and this increases their mental stress. So with own mobile, increases the interactions and hence the mental stress. So that's possible. As you said, it's more of this contagion going on rather than buffering. It kind of amplifies the anxiety.
Yes, yes.
Okay, yeah. The findings at Priya Rao, the findings of the study seem to reaffirm many structural functional beliefs about gender roles and employment. Did you find anything that challenges the existing notions?
In this context, it's hard to say, but the original study started off by looking at, and hopefully we'll get there as well, in a post-pandemic situation. It started off as a way to sort of get a little bit into this black box of norms and attitudes. Basically, we were wanting to understand drivers of female employment, especially at the margin, how to increase labor force participation of women, and how that might actually have sort of consequent implications for changing gender norms around work, around what are gender roles at the house and outside. So hopefully we'll be able to speak to some of these concerns in a coming sort of survey. But as far as this particular study is concerned, we were not able to speak to it. But hopefully there's hope for that going forward.
By Manjusha Warrior, what was the process of ethical clearance in this study, as it is an international study, and was it done in collaboration with any other agencies in India?
Yeah, no, absolutely. This is very important. So this was a study that is being funded by the Bill and Melinda Gates Foundation, and it's run through iWage, and it's done in conjunction with the Indian Statistical Institute in Delhi. And we had ethical clearance with ISI, as well as with our partners on the ground who were sort of conducting the whole survey and the entire study, which is IFMR. And so all the ethical processes were fully sort of completed and ratified, because this is kind of part of the whole credibility of the study. So yeah, we had to do all of that, and we did it.
One more question on the mental health findings by Srinivas Murthy. The mental health dimension of disasters is far more than economics and have issues relating to uncertainty, fear, change in relationships, changes in social networks and past experiences. In addition, there is scope for post-traumatic growth. Were these not considered in the study? And there is significant data on these aspects from the many disasters in India.
Yeah, no, in this context, we were just focusing on this particular crisis that unfolded around the time that, we were on the field. Yes, there is obviously a very rich literature from disaster studies to understand how people, cope with shocks, sort of, think about resilience, building resilience, and sort of, building back. But our work was essentially sort of focused very much on this particular study. And going forward, we would like to link it to the broader context of understanding how mental health implications can vary depending on the type of crisis. Again, going back to Nalini's question earlier. But for now, this paper was just focused on COVID-19.
Sure. Raghu, so I don't see any other open audience Q&A
Any
questions.
closing comments?
I could.
Any closing comments
Sanchari,
from Sanchari or both of you?
So I would just end with one thought, and why I feel that while this has been a terrible time for everybody across the world, and currently it's a really, really hard time for all of us, one thing I feel is that the lens and the focus on mental health is ever expanding, and that is a good thing, because obviously it's not that the crisis has been the first to bring this into the forefront. There has been rising awareness, but I think this has really been pushed into one of the key issues that really impact our current times. And what I would say is that with this increased awareness, with this greater sensitivity to these issues that are arising, it will be important that policy also addresses these aspects specifically. It will be a lot about economic recovery. It will be a lot about creating those safety nets, but it has to also be about specifically targeting mental health support for the vast majority, the entire spectrum of the population, where the government will play a huge role, the NGOs will play a huge role, and private companies will play a huge role in terms of supporting, bolstering, and providing that space for people to feel confident about talking about these challenges, right? I feel the conversation has now blown out into the open, and there can only be a good thing about raising awareness, dealing with this, and tackling it going forward, right? In a multi-pronged way, because these are invisible. They don't show up always in national survey estimates, but these are there, and these have genuine and very, very real implications. And going forward, policy hopefully will be sensitive to this in a way that will also destigmatize the discussion around mental health. I'll end with
that. Thank you, Sanchari. Thank you, Nalini. Thank you for throwing light on this, underserved and understudied group, and giving us food for thought for us as a community on understanding the crisis of mental health amongst various groups. So thank you for that, and thank you, Nalini, for your masterful moderation. And thank you, audiences, for joining us today. See you next time.
Thank you very much. Thank you very much. Thanks to everybody, to all the questions, and to Raghu and Lekha, and of course, Nalini. Thanks a lot.